which psychiatric drugs have withdrawals?
Which psychiatric drugs have withdrawals? Well, all of them have the potential to create physiological dependency, adaptation, and hence withdrawal symptoms. Think of it this way, the body doesn't care what we call them. The different categories are just something that we made. Obviously, the drugs are different in some sense. They do affect different neurotransmitters, and the effect of taking, say, an SSRI and a benzo or an antipsychotic, like the acute effect, is definitely different. But in terms of the mechanisms involved in adaptation and tapering, they're exactly the same. It doesn't matter what the drug does. The principle of the body adapting to it by compensating is the same. Now, some drugs may be more difficult to come off than others on a statistical sense, like more people would likely have trouble coming off, say, Cymbalta than fluoxetine due to half-life and potency and stuff like that. But it doesn't mean that there are no people having the same hell of coming off Prozac, fluoxetine, that as Cymbalta. So these statistics don't matter much, like all the psychiatric drugs can be difficult to come off because it's the same principle.
What does the research say about the different drugs?
Yeah, so the research part of it, that's a more tricky situation because definitely there's been more research on, most research, I'd say, on antidepressants and then benzos and then antipsychotics. And then the so-called mood stabilizers, Lamictal, Lyrica, gabapentin and stuff like that. There's definitely less research being done on that, but that doesn't mean that they're easier to come off. It may look like that if you just consult the guidelines and the total evidence base. It'll appear to you as if those drugs are easier to come off because there's less research, but that's not how the world works, right? They can be just as horrible to come off as the antidepressants. For some reason, we just have more research on that. And the stimulants, generally, like Ritalin and methylphenidate and Adderall and stuff like that, ADHD drugs, which are basically, a huge part of it is amphetamine. So the stimulants tend to be easier to come off, less problematic to come off than the other drug classes.
So at the end of the day, it's pretty individual.
It's very individual, yes.